Today I would like to talk to you about vaginal estrogen. Hi, my name is Dr. Alexandra Dubinskaya, and I'm a urogynecologist and sexual medicine specialist. If you're perimenopausal or postmenopausal woman or someone who just gave birth, you might have been told to start using vaginal estrogen. So why is it? Well, when our hormones level changes, especially estrogen, all our organs and system being affected by that. So when we don't have enough estrogen, the quality of tissue and the function of organs changes. And the vagina and the bladder has a lot of estrogen receptors. Vaginal estrogen helps support a healthy vaginal lining. It promotes the growth of good bacteria. And the good bacteria supports the ideal pH, and that ideal pH prevents you from having urinary tract infections. And also, when you have a healthy lining, your vagina makes more lubrication, so you don't feel dry and you feel more lubricated during sexual activity. Another perk of vaginal estrogen is that it helps with urinary urgency. That's a very common condition as we get older. So now you decided to start using vaginal estrogen, but there are different types of the vaginal estrogen. You can use the cream, you can use the ring, you can use the insert or a capsule. Some women prefer cream because it can feel a little bit more soothing, but you will experience more vaginal discharge. Some people prefer vaginal inserts because it's a little tablet that goes in the vagina and it doesn't cause as much of vaginal discharge. And some women don't want to think about it and just want to have a small ring placed in the vagina every 3 months by the doctor, or you can do it yourself actually at home. So have a discussion with your doctor and see which form of vaginal estrogen works better for you. Because all the forms of vaginal estrogen are equally effective, and it just depends on which one you prefer for your lifestyle. Once you decide which form you prefer, the doctor will send the prescription to your pharmacy. There is also some pharmacies, the online pharmacies, that do not accept insurance, but the cost of the medication there is significantly cheaper. One pharmacy that I use pretty often, and I'm not working for that pharmacy, but I just really like their service, is Cost Plus Drugs, where the tube of vaginal estrogen that will last you for 3 months costs around $30. Some patients ask me if compound prescription is better than the regular estrogen that we get from the regular pharmacy. Well, compound prescription is a great option for women who have allergy or sensitivity to any component of the regular cream. So compounding pharmacy can actually customize it for you. It's not a ready-to-go bottle or a cream. So now let's say you opted for a cream version of the vaginal estrogen. How would you apply it? Well, it's better, first of all, it's better to apply it at night. The reason being is because when you're laying down, it's more likely for cream to absorb and not come out. So there are two options. You can use a vaginal insert that comes with a vaginal cream, and you would put like 1 gram of the cream inserted in the vagina, and that's pretty much it. But some women find using vaginal applicator uncomfortable, especially if you have vaginal dryness, it can bother you. So the other option is just to apply it manually. So you can take a cream and apply it on your finger, like about an inch long strip of the cream, and then insert the finger with the cream inside of your vagina as deep as it feels comfortable for you, and just rub it around, making sure that you cover all the vaginal walls. Some people might think that the vaginal estrogen can cause cancer. This outdated belief is due to the one study that was done years ago. It's called WHI study, where they investigated the effect of systemic estrogen. But that study did have a lot of flaws of how they picked the patients, of how many years passed after menopause, what estrogen they were giving, in what form. But again, it was done for systemic hormone replacement therapy. Vaginal estrogen is a local hormone replacement therapy and very safe. Even women with a personal history of the breast cancer can use vaginal estrogen. So when you finally get your vaginal estrogen and open the box, you might see an insert with a black box warning. Well, I want to remind you that all the information written there is about systemic hormone replacement therapy, and it doesn't apply to the topical vaginal estrogen. So if you are someone who suffers with vaginal dryness, pain during sexual activity, urinary urgency, or frequent urinary tract infection, vaginal estrogen might be a good option for you. So make sure that you talk to your urogynecologist to see if you're a good candidate.